Hi there, welcome to Dr. Know-It-All's 2-minute class. Today's objectives are to find out what is post-traumatic stress disorder, PTSD, how heart disease and PTSD are linked, how to recognize the symptoms of PTSD, and what are your options to get better if you experience symptoms of PTSD. Today we welcome a very special guest, Jim. Hi Jim. He's here to learn more about his condition. Jim is a 33-year-old truck driver who suffered from PTSD after a recent heart attack. You've probably heard of the abbreviation PTSD, or post-traumatic stress disorder, before, but do you know what it is? PTSD is a disabling condition that develops after being exposed to a traumatic event. Such events often involve a threat to one's life or safety. Traumatic events can be various experiences, from the death of a loved one following an accident to a serious illness or injury, such as a heart attack. Now, you must be wondering, does it affect only Jim? Well, not at all. Approximately 1 in 4 men who has survived a heart attack show symptoms associated with PTSD. In fact, compared to heart attack survivors without PTSD, those with PTSD have double the risk of dying or experiencing a second heart attack. PTSD is a condition that has the potential to affect all heart attack survivors because of how it develops. The stressful environment or the context surrounding the heart attack and the survivor's perception of the event can increase the risk of experiencing PTSD. However, some men are more at risk of developing PTSD. Studies show that younger men such as Jim who have survived a heart attack are more likely to develop PTSD. Moreover, having previously experienced massive heart attacks also adds to the risk of developing PTSD in men, regardless of age. Jim experienced many symptoms of PTSD. One day following his cardiac arrest, Jim was driving his truck and heard sirens. This brought him right back to the day he had his heart attack. He was also very jumpy, was preoccupied with his heart rate, had angry outbursts, felt detached from others, and had difficulty experiencing pleasure when accomplishing his favorite activities, such as playing golf and driving his motorcycle. Other common symptoms associated with PTSD include flashbacks, nightmares, reckless behavior, and always being alert. True, Jim? Correct, Doc. As most men with PTSD, to try to avoid thinking and being reminded of the event, Jim started drinking more alcohol and smoking cannabis. This only made things worse. He stops both working and enjoying life with his kids. Managing PTSD is crucial to reduce your risk of getting a second heart attack and to improve your general heart health. So, what did Jim do to get better? Jim already took steps towards getting better by being here today. What do you mean, Doc? Because learning to recognize symptoms of PTSD is a great first step. Jim decided to speak to someone he trusts about his symptoms, his best friend John. Like Jim, you don't have to live this journey alone. Identify a person you trust and walk the road of recovery together. Looking for a support group is another good idea. Having contact with others who have had similar experiences can make men feel less alone. If things do not get better after 4 weeks, Jim should think about seeing his doctor or psychologist. Some treatments are very effective. If you or someone you know is a cardiac survivor and may be experiencing symptoms of PTSD, remember that you are not alone. Seeking help from professional services is important because treating the mind is the first step to fix the body. For more information, please refer to our contact details at the end of this video.